So let's study Chapter 2, Śukra Suddhirnama Sharira from Sushruta Saṁhitā Śārīrasthāna, Part 1. So here we are mainly dealing with the Śukra Duṣṭi, Ārtava Duṣṭi, Śukra Shodhana, Śukra Guna, Ārtava Shodhana, Shuddha Ārtava Gunas. Adadaha Śukra Shonida, Shuddhi Shariram Vyakhyasyamaha Yadhovaja Bhagavan Dhanvantarihi. Now we shall discourse on the chapter by name of Śukra Suddhirnama Sharira. That is a purification of the semen and the contaminant fluid, etc. as revealed by the vulnerable Dhanvantari. First, we can deal with the Duṣṭa Śukra, vitiated semen. Below mentioned kinds of Śukra or semen or sperms will not be capable of producing the offspring. Vada Pitta Sleshma, Shonida Kuneba, Granthi, Pudi Puya, Kshina Mutra Purisha Redasaha, Prajodpadani, na Samartha Bhavanti. So, Śukra Duṣṭi we can broadly classify into 8. Vada by Vadacha, that is vitiated Vada, Pittaja Śukra Duṣṭi by Pitta Vitiation, Kabaja by Kaba, Kunabha is Rekta Doṣa, Granthi Buddha Vada Kaba, Pudi Poya Pitta Kaba, Kshira Vada Pitta, and Mutra Purisha Gandhi is due to the vitiation of the all three dosha, Sannipada, Doṣa, Duṣṭi. Teshu Vada Varna Vedanam, Vadena, Pitta Varna Vedanam, Pittena, Sleshma Varna Vedanam, Sleshmanam, Shonida Varna Vedanam, Kunabagandai, Analpancha, Rektena, Granthi Budam, Sleshma Vadhabhyam, Pudi Poya Nibam, Pitta Sleshmabhyam, Kshina Prag Uktam, Pitta Marudhabhyam, Mutra Purisha Gandhi, Sannipadena, Idi. So, Śukra Duṣṭi, Vada Duṣṭi, what are the symptoms? Vada Varna Vedanam, Pitta Duṣṭi, Pitta Varna Vedanam, Kapa Duṣṭi, Sleshma Varna Vedanam, Kunaba Duṣṭi, Shonida Varna Vedanam plus Analpa. That is not little. There will be much. Granthi Duṣṭi, Vada, Kabha, Pudi Puya. That is Pitta, Kabha, Kshina. Vada Pitta, Mutra Purisha Gandhi, it is Sannipada. The same, again we can study Śukra Duṣṭi by Sushruta or Ashta Śukra Duṣṭi, Vada, Pitta, Kaba, Pudi Puya. So first is Vada, next Pitta, Kaba, and fourth is the Kunabagandha, that is Rekta, foul smelling, and it is as it is blood, that is a Rekta, Duṣṭi, there will be blood color discharge. Then Granthi, foul smelling, Vada Kaba, there will be foul smelling, first filling infection. Pudi Puya is, there will be foul smelling, Pitta Kaba, and Kshira. Okay, foul smelling, it is Pudi Puya, not Granthi. Kshira, Vada Kaba, and Mutra Purisha Gandhi, that is the having the smell of urine and feces. So you have to cancel this one, foul smelling. Next, again, Ashta Śukra Duṣṭi, we can see some symptom. That is Vadaja, semen appearing. So Vada Varna Vedanam. So appearing thin, frothy, darky. There is pain, Vedana. Vedana is the main symptom of the Vada. So there will be pain. Pittaja. What will be the burning sensation? Yellowish or reddish tint, burning sensation. Kabaja. Thick, white, slimy, heavy. Like a strand of thick thread or mucus. Kunabagandhi by Grekta. Here this is Kunabagandhi. It is cadaveric smell, dead body smell. So here Kunabarekta, it is cadaveric smell, not foul smelling, but the cadaveric smell. So Kunaba indicate the cadaver smell. Okay. That is the meaning of the Kunaba, cadaver. Now, next smells like a dead body, deep red or bloody color semen. Grandhi Bhudam. Grandhi Bhudam is the appearance of the clots or small knot or clumps. Think of lumpy tapioca, like the tapioca pearls in a liquid, we can see. Pudi Puya, Pitta Kaba resembles the Puya and has a foul smell. Pudi means a foul smell, and the Puya, there is a pus. Kshina, very scanty. So, which we told the Analpa. Analpa is the Kunabagandhi, but Alpa is Kshina, very scant or low quantity, visually thin or vanishing. Mutra Purisha Gandhi. Sannibada will be having the smell of the urine and feces, and you know, as there is Tridosha, there will be so many problems here. Next, Vadaja, visual, it is a visualization. So semen appearing, thin, frothy, darky, pain during ejaculation. Pittaja, I told there will be burning sensation, so feeling like the acid personified as a burning. Kabaja, thick, white, slimy, heavy like a strand. Kunabagandhi, it is rektaja, smells like a dead body. Grandhi Buddha, Vadakaba, appearance of the clots or small knots or clumps. Pudi Puya, Pitta Kaba, resemble pus, yellowish green, has a foul, decomposed odor. Kshina Vadapatta, it is a very scanty or low quantity of the semen, or sperm. Mutra Purisha Gandhi, Sannipada, there will be smell of urine and feces. Prognosis. Teshu Kunaba Grandhi, Pudi Puya Kshina Redasaha, Krichra Sadhyaha, Mutra Purisha Redasaha, Tu Asadhyaha, Sadhyam Anyat Chedi. That means Sadhya diseases are Vada Pitta Kaba. And Krichra Sadhya is the Kunaba Gandhi, Kunaba Gandha, Grandhi Buddha, Pudi Puyak, Shira Shukra. So all these four are Krichra Sadhya. And as you know, Asadhya is the Mutra Purishak and the symbol. So the first three, there is a single Vitiation. We can say it is a Sadhya. But single Vitiation, the Rekta is not, there is a Kunaba is not included. Vada Pitta Kaba is Sadhya. The other Kunaba, Grandhi, Pudi, Puya, Shina is Krichra Sadhya. Mutra Purisha Gandhi is Asadhya. So the same, Sadhya is Vadaja, Pittaja, Kabaja. Krichra Sadhya, it is difficult to treat. Kunaba Gandha, Grandhi Buddha, and we can treat with difficulty. Kunaba Gandha, Grandhi Buddha, Pudi Boyakshena Shukra, and Asadhya is the Mutra Purisha Gandhi. Duṣṭa Ārtava, vitiated menstrual blood. Types of Ārtava Duṣṭi. So here also we can see the 8 varieties: Vada, Pitta, Kaba, Kunaba, Gandhi, Grandhi, Buddha, Pudi, Puyak, Shira, Duṣṭi, and Mutra Purisha. So in both of them, Sushruta says in Śukra as well as Ārtava the same 8 number. Again, Ārtava abhi tribihi doshaihi shonidaha chadurtaihi pradak dvandvaihi samastaihi cha ubasrishtam abhijam bhavati. Here, based on the causative dosha, according to dosha, the Sushruta say Vada Pitta Kaba, that is the Ega, Rekta. Then Dvandva, Vada Pitta, Pitta Kaba, Vada Kaba. Dvandva, they say Vada Pitta, Pitta Kaba, Vada Kaba. Why? Because three dosha are Vada Pitta Kaba. And Sannipadaja. So, like this classification is also mentioned in the Sushruta Sharira by the Sushruta Acharya according to the causative dosha. Again, the Tadabi dosha varna vedanadi bihi vitneyam teshu kunaba grandhi podi poyak shena mutra purisha pragasha. Like this, the previous also we can see that based on the clinical feature Ārtava Duṣṭi Svada Pitta Kaba. Kunaba is Rektaja, Grandhi Buddha Vada Kaba, Pudi Puya Pitta Kaba, Kshina Vada Pitta, Mutra Purisha Gandhi Sannipada. So Ārtava Duṣṭi, types of disturbed menstruation, Vada, Pitta, Kaba, Rektajas, Kunaba Gandhi, Grandhi Buddha Vada Kaba, Pudi Puya Pitta Kaba, Kshina Vada Pitta, and Mutra Purisha Gandhi, it is Sannipada. Mutra Purisha Pragasha Asadhyam, Sadhyam Anyachedi. So here they say only Mutra Purisha Gandhi is Asadhya, all others are Sadhya. Now next is Shukra Shodhana. That is the methods of the purification of semen. Bhavanti Chatra, Teshu Adhyat, Shukra Dosham Stri, Sneha Svedadi Bihi Jayed, Kriya Visheshehi Adimams. adimams tadha cha uttara basti bihi. That is Ayurvedic manner. Shukra dosha, they for Vada Pitta Kapha, therapy like Snehana, Svedana, including Vamana, Virechana, Basti should be done. And the main treatment is Uttara Basti. So special treatment is, they mention as Uttara Basti. Kunabagandha Shukra Duṣṭi treatment. Naram Sarpir Bisha Kunabaredasi, Dhadaki Pushpa Ghadira Dhadima Archuna, Sadidam, Sadidam Payayed Adhava Sarpihi Shala Saradi Sadidam. That is for Kunabagandha Shukra, Grida prepared with the Dhadaki Pushpa Ghadira Dhadima Arjuna. This should be administered. Also, you can use the ghee prepared with the Salasaradi Gana. So here they say one is with Dadagi Pushpa, Ghadira, Dhadima, Arjuna, other is Salasaradi Gana. So here they have mentioned Grita. Grandhi Bodha Shukra Duṣṭi treatment. Grandhi Bodhe Shadi Siddham Palashe Va Abi Basmani. Here this is a one is Grida prepared with the Shadi. So Grandhi Bodha Sema having lots of club. And Grida prepared with Shadi. Also, the Grida prepared with the Basma of the Palasha. Palasha Basma Grida or Shadi Grida can be used in Grandhi Bodha Shukra. Pudi Poya Shukra Duṣṭi treatment. Parushaka Vadadibhyam Puya Prakhe Cha Sadidam. Ghee prepared with the Parushaka and Vada can be used in Pudi Poya Shukra. Sheena Shukra Duṣṭi treatment. Praguktam Vakshade Yacha Tad Karyam Sheena Redasi. So Sheena Redasi, what we have to use? The treatment told earlier, or those which are going to be described later in chapter 26. That also we can use. That is, I think it is in the Sushruta Saṁhitā Śārīrasthāna. So they have told earlier they have mentioned the Ksheena Shukra treatment that we have to follow here. Mutra Purisha Gandhi Shukra Duṣṭi treatment. Vit Prabhe Payayet Siddham Chitraga Ushira Hingu Bihi. So here in the Mutra Purisha Gandhi, we have to use the Grida prepared with Chitraga Ushira Hingu. Treatment approaches for the Shukra procedure. Snigdam Vandam Viriktancha Nirudam Anuvasidam Yojaye Shukra Doshartam Samyak Uttara Bastira. Below mentioned therapy should be considered for the treatment of the person suffering from disorders of Shukra. First is Snehana, ovulation therapy, then Vamana, emesis, Virechana, purgation, Niroha Vasti, decoction, enema therapy, Anuvasana Vasti, using the oil enema therapy, then Uttaravasti. Uttaravasti for the males is a specialized Ayurvedic Panchakarma therapy where the medicated oils or herbal decoction are introduced via the urethra to treat the urinary reproductive issues. So, before the Niruha Vasti and Anuvasana Vasti, that is through the anus or the rectum, but here Uttaravasti is through the urethra. Shuddha Shukra Lakshana, features of the pure semen. Spadigabam, Dravam Snigdam, Maduram Madhugandhicha, Shukram Ichandi Kejittu, Tailak Shaudra Nibam Tatha. So Shuddha Shukra, that Spadigabam. So white as alam, Drava, liquid, Snigda, smooth or unctuous, Madhura, taste, sweet taste, Madhu Gandhi, the smell of the honey, Tailak Shaudra Nibam. So like the oil or honey. So these are the 6 gunas of the Shuddha Shukra. Shukra with the above set features will be capable of producing the offspring. Now next is Ārtava Shodhana, methods of purification of the menstrual blood. Vidim Uttara Bastyantam, Puryad Ārtava Shuddhaye, Chadasrasho Ārtavartishu, Strinam Stehadi Yuktanam, Puryad, Kalkan Pijum Sha Abhi, Patyan Anya Chamanani Cha. So Artha vitiated by Vada Pitta Kapha Rakta, we do what therapy sending with the Uttaravasti. Here enema given through the vaginal or the urethral route along with Snehana, Svedana, Vamana, Virejana, Vasti, etc. But the main treatment is Uttaravasti. Kalka, use of paste of drug, and Pichu, a gauze or diaper to be kept in the vagina. And washing the vagina with decoction of drug also can be used. So, Artha vitiated by Vada Pitta Kapha Rakta, we do which treatment? Therapy is ending with the Uttaravasti, then Sneha, Sweta, Vamana, Virechana Vasti, Kalka and Pichu and Yoni Dhavana. Snehana, Svedana, Vamana, Virechana, Vasti. Then Uttaravasti is the main treatment. Kalka, use of paste of drugs, and Pichu, the gauze diaper to be kept in vagina. Also the Yoni Dhavana, washing the vagina. Grandhi Bhuda Ārtava. So Grandhi Bhuda means menstrual blood containing clots or clump. Grandhi Bhudhe Pibhed Padam Trayushanam Vrishchagani Vrikshagani Cha. So Grandhi Bhuda Ārtava, we use the treat with decoction for drinking made from Pada Trayushana. Trayushana means it is Pippali, Maricha and Ardraga, Shundi. So, Trayushana and Vrikshaka. So, Pada, Trayushana and Vrikshaka is used for decoction. In the Shukra Shodhana, we mentioned Grida, but in the Ārtava Duṣṭi, it is Kashaya. Pūdipoya Ārtava, Durganda Pūdipoya Majjatulya. So, when the Ārtava, the menstrual blood is foul smelling like a corpse, contains foul smelling pus or appears like a bone marrow, Durgandhi Poya Sankasho, Majjatulye Tadhartave, Piped Bhadrasriyaha Kwadam, Chandana Kwadam Evacha. So, here it is the administration of Bhadrasriya. Bhadrasriya is the Rekta Chandana or the Chandana, sandalwood. Both we can use for the decoction. Any decoction. Other kinds of Ārtava Vitiation. Shukra dosha haranamcha yoganam yadaswam avacharanam shuddhikaranam sheshaswa abhi Ārtavat Artishu. So purifying the remaining types of Ārtava, we can the recipe previously mentioned. So in the provide Shukra Shodhana we studied now, that also we can use in the remaining of the Ārtava Duṣṭi. So for purifying the remaining type of Ārtava, recipe previously mentioned for the purifying Shukra should be utilized. Now recommended diet. Diet also they have mentioned. Annam shali yavam madhyam hidam mamsancha pittalam. In condition where Ārtava is vitiated, the diet include the food prepared from shali, yava, madhya, wine, mamsa, meat. These all increases the pitta. Patya ahara. So, pitta increasing food. Patya ahara is a pitta increasing food. Also, shali, yava, mamsa, madhya. Shuddha Ārtava Lakshana, features of the pure menstrual blood. Shashasrak Pradimam, Yat tu Yat va Laksharasobhavam, Tadhartavam Prashamsandi, Yavaso na Viranchade. Navaso na Viranchade. Okay. Navaso na Viranchayed. Shashasrak Pradimam, that resembles the blood of a rabbit. Laksharasa Ubama, resemble the solution of Laksharasa. Vasana Viranchayed, means does not stain the cloth. Vasana Viranchayed. So features of the pure Ārtava, Shasha Asrak Pradimam, resemble the blood of rabbit. Laksharasa Ubamam, resemble the solution of lac. Vasana Viranchayed, does not stain the cloth. Asrakdara. We are in this we are dealing with the two topics also, Asrakdara and Nashta Ārtava, excessive and irregular menstrual bleeding. Tadeva adiprasangena pravartam anridamapi asrakdaram vijaniyat ado anyat rektalakshanaat. Asrakdara or menorrhagia is a condition in which the Ārtava, that is a menstrual blood, asiprasangena pravarta, comes out in excess quantity. So here Ārtava is coming excess quantity, anrida, flows out even apart from the regular cycle of period. And anyad rektalakshanaat, feature of such blood which flow out is different from the normal menstrual blood. Asrakdara symptom. Asrakdara bhavet sarvaha sangam ardha savedanaha tasya adivradau daurbalyam brahma murcha tamaha trisha daha pralaba pandutvam tantra rogascha vadacha. So the symptoms are asrak savedana, severe angamardha savedana, severe body pain, brahma, fainting, adivrattau, profuse bleeding, tama, darkness in front of eye, then murcha, giddiness, pralaba, delirium, pandutva, anemia, pallor, tantra, stupor, trisha, thirst, and daha, feeling of burning sensation. Then there will be disease of the vada origin also. Rakta Pitta Vidhana. So what is the treatment? Tarunya Hida Sevinya to Alpobhadrava. Bishak, Rekta Pitta Vidhanena Yadavat Samubhajare. So Asrakdara should be treated with the treatment described for managing Rekta. So here we are doing the Rekta Pitta treatment. And what should be the patient is a young woman and she used to take Hida Ahara and Alpa. Alpobhadrava. Alpa Ubhadrava. Hidam. So the conditions are the patient is a young woman and she is accustomed to take suitable food, Hida Ahara, also Alpa Ubhadrava. For her, we can give the Rekta Pitta treatment. Nashtartava, amenorrhea. Doshaihi avrada margatvad, tada Doshaihi avrada margatvad, Ārtavam nashyati striya. So when the channels, the body channels are obstructed, Doṣa avrada. Doṣa is covering and it is obstructing the normal channel, body channel, or it is obstructing the flow of the menstrual blood. Then the menstrual flow appear to be ceased. So when the channels are obstructed by the doṣa or doṣa avrada, then the Ārtavam nashyati. In this instance, specific foods and tricks are prescribed to help clear the obstruction and encourage flow. Tatra matsya kulatha amla tilamasha surahidaha pane mutram udashvicha tadadi shuktacha bhojane. So food beneficial for the nashtartava are matsya, fish, kulatha, whole scrub, amla, sour things, tila, sesame, masha, black rum. What about the liquid? Sura beer, gomutra urine of cow, udashvit dilute buttermilk, dadi curds or yogurt, shukta vinegar. Kshinam pragiridam, rektam salakshana chikilsidam, tadha abhi atra, vidhadavyam, vidhanam, nashta rektavat, evam adushta shukram, shuddhartava cha. Treatment protocol. The symptoms and treatment for the decrease of the blood should also be followed. So in the Sushruta 16th chapter, it is mentioned and this should be followed, adopted for the treatment of the decreased menstrual blood. So thank you for watching my video. Please like, share, subscribe and comment for more updates. Thank you.